my last two videos, I spoke about the diaphragmatic breath and decompressing the body with the rolled up towel. In this video, I'm going to share with you a fascia decompression routine that we can do in a block therapy class to start to cover more of the body, to release that tension, release the aches and pains that you're experiencing. So hello, my name is Catherine. I'm a block therapy instructor and fascia alignment coach. And I use block therapy's practices, what I'm going to show you today, every day to help me move with ease, to get rid of those aches and stiffness that I will feel sometimes, depending on the activities I'm doing, the posture I've been placing myself in. There's no shortage of pain, and when we've got a self-care tool like block therapy, we always have a way to get ourselves out of those aches, those pains. So the first position we're going to do is the belly position. So we showed you that in the last video, how to roll up the towel, and I showed you the belly position, but we always start the class with the belly position. And as I showed you in the last video, there's 3 different ways you can do this. You can do it in a chair, sitting and adding pressure. You can do this lying on your back, adding pressure with your hands, or you can do it lying on your stomach, putting your stomach on the towel by your belly button, and you can do this in a bed or on the floor. So I'm going to do the position lying down on the stomach. So placing the towel on the mat, lowering yourself down, finding roughly that belly button area, and if you can, staying up on your elbows. But if that causes too much strain, you can place a pillow here, or you can come all the way down straight away. Or you can loosen the towel as well if it's too much pressure in this area. Now we want to connect to that breath, so you want to be breathing in and out through the nose if you can. So in for a count of 4, feeling that belly expand. Out for a count of 6, feeling that belly going small. You will feel pain and pressure in this area, maybe even a pulse. That's all normal. The pulse is the aorta. The pain and pressure can be due to inflammation, undigested food, waste that hasn't been eliminated, and also to do with whatever we've been doing throughout that day. We might be feeling stressed and tension, the body might be holding that tension. So we're now here to relax, connect to the breath and breathe into the towel, feeling that belly expanding up, and then breathing out for a count of 6, feeling that belly going small, really sinking in, relaxing all the body. And we want to stay here for a minimum of 3 minutes. And when you've done that, you can place your hands underneath your shoulders and exhale up and out of position. So the next position I want to show you is for the sternum. So we want to open up the chest. A lot of us collapse into the body, and when we collapse into the body, the shoulders start to round forward, and then we lose the space here, we fall into the core. So we've just started to open up the stomach, and now we want to open up the chest. So the towel will go horizontally on that sternum bone, so in between the breast there, and just want to lie on top of it. Again, if you can't lie on your stomach, you can just lie on your back and add pressure into this area. And if you want to do this in a chair, you can just sit as I'm doing now and add pressure this way. That might be more than enough, but we don't want to be causing strain on our hands. So try it lying down as well, and you can also try it on your stomach. And don't forget, you can loosen the towel if it is too tense for you. So just come all the way down, come on top of the towel in that sternum area, in between the chest, and then you can just relax. You can place your head on the mat or the bed, or you can hold it up, just making sure you're supporting that neck. And let's connect to the breath. So we want to be breathing in for a count of 4, so feeling that belly expand, and then expand that breath up to where the towel is, and then exhaling for a count of 6, feeling that belly going small. And being here might be absolutely more than enough for you. You might have enough sensations. You will feel again pain and pressure. You may feel some refer pain on your back, your upper back, and that's just showing you that this site here, the sternum, is potentially a cause site for the pain that you might be feeling in your upper back. But we can start to twist if you want to, which is just adding some pressure more to one side. So if we add pressure to the left and turn a little bit to the right, these are very small movements. The slower we move, the more that we can then connect to all areas of pain or tension, and keep connecting to that diaphragmatic breath. And then once you've been at that side for a while, you can then slowly come back to center, and then drop that right shoulder and twist over to the left and focus more on this right side. Again, keep connecting to that diaphragmatic breathing. And once you've been in this position for a minimum of 3 minutes, you want to very slowly, because you will have sunk into position, and move on the exhale, place your hands under your shoulders and exhale up and out of position. So the next position I'm going to show you is on the piriformis, on the bottom. We can do it in the centre or on either side, so depending on how much time you've got, depends on what positions you want to do and for how long. So I'm going to show you a few different positions that you can do in this area. This area can help to reduce any lower back pain you might be feeling, and when we are not standing correctly, we can cause a lot of tension in the piriformis, in the bum. So this is releasing that tension, which can help then with any back pain that you might be feeling, but also overall pain that you might feel in your legs as well. So what you want to do for this is lie on a bed or on the mat. You can also do this by sitting on the towel on the chair as well, if you prefer to do that on a chair. So lying down and then lifting up the pelvis and then just placing it roughly where the bum crack is. You can just place it on it, just below it. Don't worry about exact positioning, just somewhere in that area. Feel stable. You can have your feet flat on the ground. You can hold onto the towel. You can place your hands on your stomach and then connect to that breath. So you want to be breathing in for a count of 4, feeling that belly expand, and then breathing out for a count of 6, feeling that belly going small, imagining that belly button's going to the back of the spine, and you can always hold for a moment before you take your next breath. Now just staying like this, you can straighten out the legs if that feels more comfortable for you, or you can start to lift the legs. You can lift both or you can lift one, whatever feels good for you. And slowly make some movements, feeling where you need to be. The closer you bring your legs up, the more tension it might feel. And then you can drop to one side, putting the legs more to the left. You keep one foot on the ground. So you're in control and your breath is always guiding you. If you take yourself into a position where it takes that breath away, you just want to move back to where you could breathe in more a relaxed way. The breath is always there to protect you, so we want to be always breathing in a relaxed way. And then once you've done one side, you can lift up and add more pressure over to the other side as well. And again, you want to stay in this position for a minimum of 3 minutes. And if you want to, you can add more pressure by moving it more over to the left side and focusing on that side, and then lifting up and moving more over to the right side. So there's a few different areas you can cover on here as well. And then once you finish, just lift up, remove the towel, and then roll over to one side and exhale up. I just showed you a couple of positions, doing the stomach, the sternum and the piriformis, and they're just 3 positions. There's so many positions that we do in a block therapy class. When we fall out of alignment, when we are doing activities, sitting down, not moving as much as we can, the fascia in our body, which is the connective tissue, starts to twist and turn and lock us out of alignment, which is causing the tension, the stiffness, and eventually the pain that we feel. So these classes are here to decompress that compression, inflate the area with the diaphragmatic breath, and that helps us to melt away those restrictions. If you enjoyed those 3 positions, I've got other classes on my YouTube channel, but I also do online classes. There's a link in my description to join a class. In these classes, we cover the full body, and these classes are suitable for everybody. I help you with modifications so that you can do these classes depending on what mobility you have at this time. So thank you so much for joining me, and I look forward to seeing you in class soon.